Hello students, I am having a water bottle which already has some water, that is old water. Now if I add some extra water to this old water bottle, then there is new water as well as old water. This new water, what I am adding is incidence, whereas this water bottle which has both old and new water is prevalence. I hope you understood prevalence. Now, what is the formula for prevalence? If I add this water, that is incidence, this new incidence is 2 liters of water for 2 minutes. So 2 liter of water added to the water bottle in 2 minutes. So the prevalence is 2 minutes of water into 2 liters, that is 2 into 2, 4. So prevalence is equal to incidence into duration. Remember this. Whereas incidence is equal to prevalence divided by duration. Follow this. Prevalence and incidence is over. With this understanding, you just see this picture, you will understand what is prevalence, what is incidence. See the prevalence of a disease between January 1 and December 31. Between these two periods, how many number of new and old cases? You see, case 1 is there between January 1 to December 31. Case 2 is also there between January 1 and December 31. Case 3 is also there between January 1 and December 31. Case 4 is inside January 1, December 31. Case 5 is also inside, but case 6 is outside December 31, not between these periods. So, it is not included in the prevalence. Case 7 is also there, case 8 is also there. So, that is period prevalence, the prevalence of a disease between January 1 and December 31. Between this period, that is 1 year period, is 7 out of 8. Now, what is point prevalence is January 1? You see case number 1, case number 2 and case number 7. What is point prevalence as December 31? Case number 1, case number 3, case number 5 and case number 8. Whatever crosses that line. And what is the incidence between January 1 and December 31? That is 4 cases are occurring newly between January 1 and December 31. That is case 3, case 4, case 5 and case 8. So the incidence is 4. So now you understood incidence, what is point prevalence, what is period prevalence. Now we will see the formula. Incidence is number of new cases during a specified time period divided by population at risk during this period into 1000. Here the unit of time in the final expression should be there. If you write 16 per 7 per 1000, it is not enough. You have to write 16 per 7 per 1000 per year. That unit of time is very important. That is why incidence is prevalence divided by duration. Incidence rate can be two types, that is attack rate and secondary attack rate. What is the use of incidence? To control disease, for research into etiology and pathogenesis and distribution of disease and efficacy of preventive and therapeutic measures. In all these things, we want to see whether something newly is occurring or something which is newly occurring is controlled. This is what we are going to see in incidence. Whereas prevalence is current cases, that is old and new, existing at a given point in time or over a period of time. Given point of time is point prevalence. Period of time is period prevalence. So accordingly, the formula is point prevalence is number of all current cases existing at a given point of time divided by estimated total population at the same time into 100. And period prevalence is number of existing cases during a given period of time interval estimated mid-year population risk into 100. What are the uses of prevalence? Prevalence helps to estimate the magnitude of health problem in the community and identify potential high-risk population. Prevalence rates are especially useful for administrative and planning purposes. How many hospital beds are there? How much manpower is needed? Rehabilitation facilities, how many are there? So prevalence gives us a snapshot. It gives us a picture, photographic picture of existing problem or existing cases. Whatever it is, prevalence is just a picture. Remember, it is at a point of time or over a period of time, what is the picture we are seeing. So that's why it is useful for planning purposes and administrative purposes. And incidence is useful for monitoring purposes. Whether it is controlled or not, something is controlled or not, we can see with incidence. So that's all about incidence and prevalence. You need not refer anything else beyond this video for incidence and prevalence. Thank you very much. If you like this video, press the like button, share with your friends, follow our channel for community medicine updates.